Notice the frosting starting in certain areas. Hydrated skin, hydrated areas frost earlier. Drier area frost later, slower. That's why skin conditioning is very important. When my patients are conditioned, when I do this, the frost very nice and even everywhere. So this patient was not using proper conditioning. Now my job, as I show you, see, I'm just going around in circles and painting evenly everywhere, waiting for the frost to appear. It's very simple procedure if you follow it nicely, very artistic, very safe.
Dr. Obagi, in case you use CO2 laser, Fraxel laser, do you do it before the peel or after the peel?
After the peel.
Okay.
The peel get me to the depth I want everywhere, then I take the CO2 laser, I work on the hard tissue.
After how long?
What's mean after how long?
Just immediately after
Immediately.
the peel? Immediately.
When I finish the blue peel, I do the CO2 fraction.
Okay.
And can you combine fractionated CO2 or erbium with retinol? You know.
Can you do what? Your erbium? Fraction with erbium? Yeah.
Yes, but laser before to make the channels, and then you put the retinol.
Fraxel refine.
You put then you do the blue peel? I don't understand what
No. Apart from the blue peel, can you combine a laser for the channels to make the channels, and then you put retinol?
Retinol stimulation on top?
Yes.
I think you can, but I don't know how much irritation you will have in the skin. I have no idea, because with the erbium you are removing the epidermis,
Yes.
so it's very irritating. Very irritating. But I don't know. I never tried it, but you can try it. See,
No, I've seen it in INCAS Congress in France,
Yeah.
in Paris, and it was
Ma ergo Fraxel, no? The continuous way.
fractionated. Only to make the channel per permettere l'accesso allo spirito.
Usually with aminolevuline casi for photodynamic therapy before you give a first pass with Fraxel.
See here where the frost is almost sheet. Look at the epidermal sliding. See the wrinkles? That's very good sign. Yeah, see epidermal sliding, but starting to appear. So I'm reaching the papillary dermis.
Dr. Obagi, what do you think about LED therapy after the blue peel?
Mesotherapy.
No, LED is a light LED.
LED. Oh yes, very good. It reduces the redness
Yeah.
after the peel. We have it in our office. So the frost is forming nicely. Notice because her skin is thin, I will be using almost half the coat. not all that like the other lady who had thick skin. We used all of it. Here they use less volume because it's thin skin.
20%.
Yeah. Frost with sheet, pink background, epidermal sliding. Very classic, all the signs. You see that? Epidermal sliding. So I'm in the papillary dermis. Epidermal sliding, frost like sheet and epidermal sliding. Because she had melasma, you have to train your eyes. There's a pink underneath. You can see it, but sometimes with the melanin you may not think it's pink. It's pink. But the epidermal sliding shows you. Notice here where there's no melasma, the pink is more showing.
So, which is the advantage of the blue methylene?
What's that?
Which is the advantage to use
The blue make you. It's a color guide. If you don't have a blue, you don't know how even you applied the acid. So the blue is very important as a guide.
Without
Notice
blue-
here I did not put enough acid. See, it's less blue.
It's transparent, so you don't see where it goes. If you
Yeah.
do not-
If it is water colorless, you will
Like
not know
water,
how
you don't know
what
where it
area
goes.
you forgot.
But you see the
Frost.
The frost.
Yeah, but the frost is not enough by itself. The pink doesn't show very well without the blue. See the blue sky, you see a sunset, red, orange, blue ocean, you see everything. Without the blue, you see nothing. You see frost. There is no shortcut. Here you can see where there is no melasma, the pink is showing more here. Here where you have melasma, the pink is showing more gray, a little bit more of brownish. So that's the peel that she should do every couple of months until the melasma is gone. That's how we do it.
How many blue peel every 2 months can you do?
In 2 months I can do the same thing.
Just the same.
Yeah. In 2 months.
What do you think about the phenol peel?
I don't think phenol peel is a peel and used anymore. Very few people use it. In America, almost nobody uses it. There is a Becker formula and there is also Hutter formula and all that stuff. It's thin the skin, it kills melanocytes. It is absolutely, I don't think it's a good peel. Except for white skin maybe where there's no color to worry about. It is excellent, the results are wonderful, but it's toxic, it's invasive, and you have to really be careful with that. I can do everything with TCA, I don't need phenol. Notice Notice now we are evening everything out. That's the peel to the IRD and some of the cheek area and the forehead. I went a little bit less red. Here you can see the pink. Here you can see the pink. The melasma, I went a little bit less, made it less pink. I went a little bit deeper where you have the melasma. The forehead was very bad. Give me a Q-tip. Just once I see the frost on the eyelid showing, and that's usually time to stop. You can see now how nice all the way to the eyelashes. It tightened the eyelids very nicely. Now you can see the even frost, even blue. The pink showing behind the frost. Here you have less pink because I went deeper here. No sharp demarcation line. No sharp demarcation line. That's the blue peel. So if everybody can do a good job. Even blue, even frost.